lecture we will be discussing about the two things. One of them is normal sinus rhythm, another is sinus bradycardia. First we'll be discussing about the sinus rhythm. What is the sinus rhythm? Sinus rhythm is a normal cardiac rhythm. Sinus rhythm is a normal cardiac rhythm in which the heart is stimulated by natural pacemaker. I mean SA node with a firing frequency of 60 to 100 beats per minute, on the average 75 beats per minute. So sinus rhythm is a normal cardiac rhythm in which the heart is stimulated by a natural pacemaker. I mean SA node with a firing frequency of 60 to 100 beats per minute, on the average 75 beats per minute. Characteristic feature of a sinus rhythm, I mean key points of the ECG of sinus rhythm. What is the characteristic feature of a sinus rhythm in ECG? Three things is very important in the characteristic. The first, the heart rate. The heart rate is between 60 to 100 beats per minute. On the average 75 beats per minute. The second, every PVF should be followed by QRS complex. Every PVF should be followed by QRS complex. And the third one, the PVF is an upright in lead 2 and inverted in lead AVR. This was about the sinus rhythm. Again, sinus rhythm is a normal cardiac rhythm in which the heart is stimulated by natural pacemaker, I mean SA node, with a firing frequency of 60 to 100 beats per minute, on the average 75 beats per minute. The characteristic feature of the sinus rhythm or key point of ECG of sinus rhythm. The first thing, the heart rate is less than the heart rate between 60 to 100 beats per minute. The second, the P wave is upright in lead 2 and inverted in lead AVR. And every P wave should be followed by a QRS complex. P wave, QRS complex, P wave, QRS complex, P wave, QRS complex. This is the characteristic feature of those people who have got normal sinus rhythm. Three things, especially heart rates. Another, for example, heart rate in patient with normal sinus rhythm is 60 to 100 beats per minute, on the average 75 beats per minute. The P wave is upright in lead 2 and inverted in lead AVR, and every P wave should be followed by a QRS complex. This is called normal sinus rhythm. After the normal sinus rhythm, we will be discussing about another rhythm, which is called bradyarrhythmia, especially bradycardia. Bradycardia or sinus bradycardia. Sinus bradycardia is a sinus rhythm in which the heart rate becomes less than 60 beats per minute. Sinus bradycardia is a sinus rhythm in which the heart rate becomes less than 60 beats per minute. The P wave is upright in lead 2 and inverted in lead AVR. The characteristic feature of a sinus bradycardia is defined. Sinus bradycardia is a sinus rhythm in which the heart rate becomes less than 60 beats per minute. And every P wave should be followed by QRS complex. And P wave should be upright in lead 2 and inverted in lead AVR. For example, this is the key point. For example, there are 1, 2, 3, 4, 5, 6. We have got 6 boxes, large boxes, or 6 large boxes. Right now, these 6 boxes should be divided by 300. It becomes, the result is 50. So the sinus bradycardia is the sinus rhythm in which the heart rate becomes less than 60 beats per minute. This is the first criteria. The second, the P wave is upright in lead 2 and inverted in lead AVR. And every P wave should be followed by QRS complex. Remember, it is unusual for sinus bradycardia to be less than 40 beats per minute. If a patient has got less than 40 beats per minute, we should consider about the other alternatives. For example, heart block. In addition to the sinus bradycardia can be a normal finding in 2 categories of the people. First, those who are athletes, and especially another during the sleep. If you take the ECG of the patient during the sleep, they develop sinus bradycardia. If it is in the sleep, it represents a normal finding. The second thing, if there is an athlete and you want to take the ECG of that patient, the heart rate may be also less than 60 per minute. But these are the normal findings in these 2 categories of the people. One is athlete, another is during the sleep. So, right now we'll be discussing about the causes of a sinus bradycardia. The first thing, should drugs. Which drug? Negative chronotropic drugs. For example, calcium channel blocker, beta blocker, adenosine and digoxin. So the first causes is drugs. Those drugs which are common and lead to bradyarrhythmia is beta blocker, calcium channel blocker, adenosine and digoxin. Or totally we say those drugs which have negative chronotropic effect. After the drugs, the second thing is ischemia and infarction. Especially which type of infarction? Inferior or lemma. This was about the second causes of bradyarrhythmia. And the third one is hypothyroidism. Yeah. Hypothyroidism. And the fourth one, hypothermia and electrolyte abnormalities. And the sixth one is obstructive jaundice and uremia, ICP, and sick sinus syndrome. So as I mentioned before, it is unusual for sinus bradycardia to become less than 40. If you have found that the patient have got less than 40 beats per minute, we should think about the heart block. We should think about the heart block. The heart block, if the sinus rhythm become less than 40, we should think about the heart block. What would be the other cause of the sinus bradycardia? The first common cause of sinus bradycardia, drugs, especially calcium channel blocker, beta blocker, and negatively chronotropic agent. And the second, ischemic heart disease, most likely amine, especially inferior or amine. The third, hypothyroidism. And the fourth one, hypothermia. And the fifth one, electrolyte abnormality. And the sixth, obstructive jaundice. And finally, intracranial pressure, as well as sick sinus syndrome. This was the causes of the sinus bradycardia. If a sinus bradycardia is severe, if a sinus bradycardia is severe and sinus arrest and SA nodal block is prolonged, they produce another rhythm by name of the escape beat and escape rhythm. We will have a detailed discussion about the concept of the escape rhythm and escape rhythm in my future lectures. This was about the sinus bradycardia. Right, we'll be discussing about the treatment of the sinus bradycardia. The first step in the treatment of the sinus bradycardia is evaluation of the patient or assessing of the patient whether he is urgent or not. The second thing, we should ask the patient about the symptom. Which symptom of the sinus bradycardia? For example, dizziness, fatigue, fall, shortness of breath, palpitation, and chest pain. Yeah. These symptoms are related to those people who have got sinus bradycardia. And the third thing that we should ask from the patient is a drug history. Drug history, especially which drug? Again, calcium channel blocker, beta blocker, adenosine, and digoxin. These are the drugs which have got negative inotropic actions. After the drug,
physical examination.
Which one?
Physical examination.
Like other physical examination. Physical examination, especially thorough physical examination from top to bottom. This was especially if you have found in a physical examination hemodynamic change or hemodynamic disturbances. For example, the blood pressure was less than 100, cold cream skin, and dull sensorium is present. This represents hemodynamic disturbances or hemodynamic change. And the third one, further investigation. In case of sinus bradycardia, especially electrolyte abnormality. And the second thing that you should pay attention about the TFT, thyroid function test. If you detect it, we should treat it. And the last one.
Now come to the drug treatment.
Yes, drug treatment, yeah. This was a general measure in those people who have got bradyarrhythmia. What is our general first step? First step is evaluation of the patient. If this patient is urgent or non-urgent. The second thing, you ask the patient from those symptoms which represent bradyarrhythmia. For example, dizziness, syncope, fall, fatigue, chest pain, shortness of breath, and palpitation. These symptoms represent bradyarrhythmia. And another one,
physical examination.
Physical examination. During the physical examination, especially we should ask for drug history. And ECG drug history is very important. Drug history, especially those people who are receiving negatively inotropic drugs, such as beta blocker, calcium channel blocker, and adenosine. And the final,
further investigation.
In further investigation, we should give for the patient some tests, especially electrolyte abnormalities. And the second one, and TFT, thyroid function test. This was about the evaluation of the patient. Right now, we'll come to the treatment of bradyarrhythmia. How should I treat the bradyarrhythmia? First, you should think about the drugs. First, you should think about the drug. Reduce or discontinuation of the drug, or stopping or reduce of the drug. Because some people have got ischemic heart disease. There is a rule: when you want to reduce the anti-angina drug, you should taper, and you should not immediately discontinue. So there are two things. It's taper, or we should reduce the dose of the drug. The second thing, abnormal rhythm should be corrected. And the third one is hypothyroidism. If the TFT and clinic of the patient shows hypothyroidism, we should give for this patient thyroxine, or we should treat the hypothyroidism. Again, if the patient is urgent and the clinical situation of the patient has worsened and he changed from a stable condition to unstable condition, for example, in urgent situation, first what should we do? For these cases, we should give for the patient atropine. How much the dose of atropine? They have mentioned 200 to 600 ECG. And the final dose for atropine, the dose of the atropine should not be more than 3 milligram in 24 hours. So with this atropine, we just manage the patient and we prepare the patient for temporary pacings. Yeah. In spite of the temporary pacing, if the patient again develop chronic condition, vertigo, dizziness, chest pain, palpitation, fatigue, fall, this patient represents chronic condition. This patient is candidate for permanent pacing. So atropine for temporary pacing for permanent pacing. This was about the sinus bradycardia. What are remains? So two things in all ECG should not be forget. These are very nice and good things. And complete drug history is essential in any patient with abnormal ECG. For example, if you have seen an abnormal ECG, you should ask from the patient about the drug. So drug history in case of the arrhythmia is very important because some of these drugs themselves are arrhythmogenic. So this complete drug history is essential for any patient who have got abnormal ECG. You should take the history of the patient in regarding of the drug. In addition that you ask from the patient if it is stable or not stable. The second thing you should ask about the symptom. We have discussed about the symptom of bradycardia. The third one, which is very important, you should think about the drug history. So and therefore they mention a complete drug history is essential in any patient with abnormal ECG. This was about the drugs. The second thing, bradycardia finally may require pacing if symptomatic. Bradycardia may require pacing if symptomatic. So and therefore, you should seek the advice of cardiologist for administration or for application of the permanent pacemaker. One is a complete drug history is essential in all type of arrhythmia, especially in bradyarrhythmia. Those drugs which produce bradyarrhythmia is calcium channel blocker, beta blocker, adenosine digoxin, or totally we say for this kind of drugs, and negative chronotropic, thromotropic drugs. And the second thing, if the patient of bradyarrhythmia is symptomatic, we should seek the advice of cardiologist very soon. This was about the sinus bradycardia and normal sinus rhythm. I will repeat again.